My practice social service conducted with the premise of INCODE, that means Instituto Colimense del Deporte, where I have contact with several athletes from different sports, age, gender, and categories, whether hobby athletes or state, national, or international competitors. My work in the institution is to receive and respond to each of the athletes of different sports, to give nutritional care, either to have a healthy weight in sports which are governed by the category weights, or improve physical performance in training and skills. My work is very interesting. I have to read to know the nutritional requirements according to the sport of each athlete and personal characteristics. But at times it gets boring because there are very few athletes that go and commit to follow the diet. But even so, there are several competitors who follow the program, and it helps me to value my intervention and correct errors that may have made. Another of my work in my practice is to watch for the weights and physical performance of the selection of judo. Are children and young people from 12 and 19 years old. Some are national competitors and other international competitors. Have brought medals every competition they go, so it's a great responsibility to work with them. I explain nutritional topics in different subjects but parents and competitors, with the intention that they know how important nutrition for physical performance. Also, I do anthropometric measurements and preparation of diet for each of them to improve performance and not leave the weight category to which they correspond. I love my practice, but still much to promote good eating habits in athletes. So I elaborate materials but to expose to the group of judo and to be left on view in the office where other athletes can see them.
Hi, my name is Jervin. I'm gonna explain about my activities and my responsibility in the nutrition service. My schedule is from 11 a.m. to 3 p.m. and the first thing that what I do is carry snack from to pediatric service, and the snack generally is banana and apple and cucumber, and when the patient has a disease, for example diabetes, the snack is a pear. Another responsibility is review the menu. I have to see in the menu is healthy, is appropriate, and the most important, the menu have to be hygienic. An important thing or part and in the service is the appointment. In the appointment, we have to attend the special occasions, and we try to explain for the patient what is the best form to eat, and finally, and each month we celebrate the birthday or co-workers, and I think that it's all. Thank
For my constitutional duty, I choose the Hospital Regional Universitario. I went to the hospital to 8 a.m. to 12 p.m. When I come to the hospital, I go into the kitchen and we check the diets of the Pilar. These diets are the total diets of the day. Uh, we told to the cook which type of food the diet can bring and which type of food cannot bring to the patient. Sometimes the doctor need us for the inside consultation. This type of consultation sometimes come to the area of pediatrics and medicine internal and surgery. Sometimes we need to see the patient, and sometimes only with the expedient can can bring the diet to the patient. We need to see the symptoms and the pathologies. Uh, in this consultation, we go into the. After that, we go into a room, and in the computer we had a program of nutrition that help us to calculate and make the calcul more easy and faster. After that, we go into the kitchen and slide the diet on the Pilar. And only on Tuesday and Thursday, we had an external consultation. In this consultation, we bring to the patient personal information, and we need more information that the patient, for example, their clinic history and the personal pathologies, and we do a recordatory of 24 hours.
In the clinic hospital ISTE. I'm trying to be a nutritionist. My work is based on analyze the nutritional status of the hospitalized patients and supervising the kitchen area and the nutritional counseling to patients. I work with persons who are hospitalized and who have diabetes and hypertension, heart disease, malnutrition, obesity, and others. I work in a small office inside of the hospital. I check the diet of the patients for to pass information to the cooks. Also, I make the monthly reports of total diet and the supervision of the food service. Social service, I like to help people. Sometimes they talk about personal things, and this makes to have empathy between us, and this is gratifying for me.
Hi, I will talk about my service in the Sound General Hospital number 1 in the Inns. Every day I wake up at 6 a.m. and when I arrive to the hospital, the first thing I do is the census. The census consists in check the experience for the patients, check the name, check the number of the bed, check the disease, and the most important thing in the census is check the type of diet. The first census is 6:30 in the morning for the breakfast. When I arrive, I check my list. I'm going to first in internal medicine, and later I check the experience. I check and I can change the type of diet if I talk with the doctor. Later, I go to renal nephrology service with the renal patients. Later, I go to the gynecologist, and later in pediatrician. When I finish the census, I go to the kitchen. I do papers with the number of the bed, the name of the patient, and the type of diet, and I give from the cook. And later, in the kitchen, the cooks make the food from the patient. Later, with the car with all the food, I go into all the patients and I check the type of diet, and I check the patient receive the correctly food, and this is the first thing I do in my day. The breakfast in the hospital service is from the 7:30 a.m. Later, I check the patients from the experience, and if I like the patient, the type of disease, or if the patient have a diabetes or overweight problems, I do the interconsult. The interconsult consists in from an interview with the patient directly or with the family. I'm going and I do the interview. I check their 24 hours recordatory or the frequencies consumed. And later, I do the nutritional advices from the health to the patients, and later I annex the paper with all the interview in the experience. All day I have 1 or 2 patients, not too much patients, and later I come back to the kitchen. I check the type of menu, and I can help to calculate the calories from the menu stipulated in the inns. Later, on the 10:30 a.m., I got to do the second census. It's equal like a first census, but this is from the dinner. And later, I go home. My work in the hospital is not too hard, but it's necessary.